Thinking about where healthcare is going to go in the next 5 years is a really interesting question. I'm not sure I have a perfect crystal ball, but I think that we're going to see value-based care continue to grow, and I think it will ultimately become the dominant model. Providers will take most of the risk, and the care delivery systems will evolve to much tighter networks. Care will be coordinated much better across the continuum. I think the other interesting thing to think about is what are going to be the respective roles of health plans and payers. We're seeing that payers are starting to act more like providers. They're buying practices, they're getting more into the care delivery business, they're getting more into the vendor space. On the other side, we see that providers are starting to form and offer their own health plans. We're seeing some of them start to have vendor-like IT offerings or service offerings. So I think the boundaries between health plans and payers are starting to very much blur, and it's not entirely clear what each of their respective roles are going to be. As we think about the intersection of payers and providers, I think each are trying to figure out what their future business models are going to be and what the scope of services that they each offer are going to be. Both sides of the coin, if you will, the providers and the payers, are both facing challenges with respect to their business models and also with respect to how each are adopting to the changing reimbursement model, specifically value-based care. So when you think about the insurance companies, they have to adopt to a new business model. To administer value-based programs and contracts with providers is very different than fee-for-service administration. It requires a whole new set of tools, whole new types of data. There's complexities with their providers being in a mix of fee-for-service programs, bundles, total cost of care models all at the same time. Their legacy systems aren't designed to manage these value-based care models, especially multiple models simultaneously, and that creates a lot of complexity that they need expertise for and systems for, and that represents a lot of change. So for providers, they're somewhat living in two worlds, a part fee-for-service world and a part value-based world, and those have diametrically opposed incentives. So, and they need to figure out how they can align their organizations around a unifying operating model, because it's almost impossible to be successful if you're trying to optimize for both of those phenomena. At the same time, they're adopting a new care model. They have to drive alignment among their physicians, and they need a whole variety of new processes, both clinical and administrative, to be able to be successful in sort of the adoption of, if you will, a population health model, which is the core requirement to be successful in a value-based world. That brings along with it all kinds of needs for data acquisition, IT infrastructures, new areas of expertise which typically don't reside in health systems. I think it's really important for an organization as they're transitioning into value-based care and becoming a value-based care delivery system to really prioritize what they're going to do, not to overwhelm their system nor their providers with too many things at one time, but develop a multi-year rollout plan that's prioritized on what will give them the biggest yield and set the best foundation from the beginning, and then proceed from there. And then as they think about each step, make sure that they're putting in place the right processes, the right people, and the right IT to support each of those steps along the way. I think the organizations I've seen that have been most successful have taken a very thoughtful, deliberate, and progressive approach to transitioning themselves into a true value-based care delivery system.